Welcome to Chapter 6, Biological and Chemical Agents. So we're going to talk about some of the terms relating to the chemical and biological agents, the management of these chemical and biological agents, and actions to deal with the chemical and biological agents. So definition of the agent is any substance, chemical, or biological to which a human may be exposed to work. So that's fairly broad definition. Biohazards, infectious organisms, proteins, nucleic acids, chemical agents created by exposure to chemicals. So that could be, again, things that we've talked about before, bleach, even things like powders that are can be dangerous. So here's a nice, well, maybe not nice is the right word, but here is a summary of bacterial, viral, fungal, prion, which is something that is get talked about very much. But here's just a breakdown of the things that we've heard about, things like anthrax, salmonella, serum hepatitis, hepatitis B and A, which you can get vaccines for. So you have to try and find the chain of infection. Unfortunately, in today's pandemic world, this is something that we are monitoring and trying to find hotspots and where people got infected and how it transmits, or how that led to a transmission situation. I know that one of you had mentioned that you're home isolating because one of your children was exposed at school. So trying to reduce the infection and the chain. So again, here's the chain of infection, whether it be respiratory or respiratory, however you want to pronounce it, etc. So we've become very well aware of this during the COVID pandemic. So some of the biohazards, I'm not going to go through this in great detail, but where it's hosted in where it is in the host, it's the reservoir, where it exits, and if something like COVID was not transmitted via air, it would be a lot less serious hazard than what it currently is. How it goes from one host to another, touch. So somebody touches something that has COVID, you touch it, you get it or may get it, and that's why washing hands, etc. And again, somebody who's susceptible to it. And we found out, unfortunately, that people of all ages are susceptible to COVID. Doesn't matter your age, but the effects on you does. So biological are natural organisms. Diseases, Legionnaire's disease, which you probably have to look up, but it was a big thing many years ago. They didn't even know what it was, and it's happened in Philadelphia at a Legionnaire's convention. That's why it's called Legionnaire's disease. AIDS, which I think you are all familiar with in today's world. SARS, which is related to COVID. Toxicity, the ability to cause injury to human biological tissue. Aerosols, liquid or droplets, etc. So chemical agents, you can see there's over 70,000 chemicals used in North America, and it goes up by over 10% a year, 800 new ones, and we're not even sure of some of the effects, but they have to be monitored and controlled, and we have to be wary of them. And you can see there's no toxicity data for about 80% of the chemicals. Some chemicals that were thought to be fairly innocuous over long periods of time can cause like skin cancer, things along that line. So long-term exposure is not perhaps known. and even some low-level exposures like headaches, dry nasal passages, and things like this. Again, toxicity or toxicology, study of poisons. Chemical enters the body through respiration, so you inhale it, absorb it through your skin, you ingest it, or it penetrates your skin. So it goes through a cut in your skin. So most of it is for breathing in your nose, nasal passages, lungs, etc. So here's a wonderful diagram of your lungs and your bronchus and trachea and all of those fun words. Absorption is also common, where sometimes you deliberately absorb something. So if you spill something, a lot of us have just even wiped it up with our hand and it absorbs into the skin. It's no big deal. But you wouldn't do that for certain types of chemicals. So you can have, it can cause burns, blisters, skin disorders, damage the skin from radiation or heat. So that's where you would get a burn, or if you've ever had, hopefully you've never had it, where you've had sun on your skin, so it just doesn't burn. It actually causes boils. I've had that one time. It was one of the most painful experiences of my entire life. Ingestion, poor personal hygiene, eating, drinking, smoking, etc. So this, so that's why, people get all upset these days about smoking in an enclosed space. Or some people even get upset when you see somebody smoking in their car, even though it's their car. And again, it can cause damage to the digestive system, and it can be absorbed into the bloodstream. So penetration it goes through a cut or puncture. And so people, especially in the healthcare field, have to be very careful of this, but so do others. That's why we wear protective gloves and things along that line. And even if we do get a cut and we need to make sure it doesn't get infected, we wash it, we put antiseptic on it, maybe have to take antibiotics, on and on and on. But it gets into our bodies through an opening that would not normally be there. Again, some properties of solvents. They have high vapor pressure, low boiling points, etc. I'm not going to, again, read through each one individually for your test. Just make sure that you have this slide available if it's on the study guide that you were given. So you have two solvents, acids and bases. One that we tend to talk about much more is acids, but strong bases can, on the pH level, can cause severe injuries and skin reactions and toxicity. So some hydrochloric acid, sulfuric acid, it's very corrosive. People could die very quickly if they were to ingest hydrochloric acid or sulfuric acid. It eats away at the trachea, etc. Bases, alkalines, potassium hydroxide, sodium hydroxide, etc. And some of it is, you can see salt is something we take voluntarily. And too much of it, though, too much of it is not good for your system. It can cause issues with your blood pressure in your veins and things along this line. But it is also toxic. Organic, petrochemical based, or you can have it also manufactured. There's a classification table Don't go into all the details. You certainly don't need to remember all of these, like alcohols, ethers, the hydrocarbons, etc. This is just way too much detail for what you'd be asked on a midterm exam. Control, engineering control substitutes with less hazardous solvents. Maybe it can be diluted or can be done in a powder form instead of a liquid form. Again, one of the most dangerous things is the ventilation or air, where it's aerated. And closing it in. So you would have a system that I mentioned in class of even for, you would want to have an enclosed unit, and when that person goes in to say that enclosed room, the person is wearing proper PPE. And you just don't vent things out, exhaust out into the atmosphere anymore. That's a no-no. So again, here's some labelings or labels with MSDSs, which is part of your WEMIS or WEMIS. And again, change rooms, I wash stations, things along this line. And again, record keeping, etc. Make sure that you have everything labeled properly, so people people are trained, and people are trained in the knowing what the labels mean, how to deal with them, what equipment to wear, what protect, and how to deal with exposure to the equipment or the chemicals in this particular case. Again, engineering systems, closed systems, where you don't have it open. So what I mean by that is, again, you have a closed room. It's the best example I can think of. And it has its own ventilation system, and you just don't allow that toxicity to be exposed to the rest of the plant or the organization. Again, making sure that people are familiar with WEMIS and the legislation, which you all have the assignment on. And again, the safety data sheets, or as they were called quite often, material safety data sheets, or SDSs, updated in 2015, which you are familiar with in the next chapter. Again, classifications. Canada went to a global system on WEMIS, or as you people like to call it, WEMIS. And again, here's some labeling that you have, and we've talked about this. Explosion, flame, which I think we're all very familiar with. The one with the circle, probably a little less. Flame over circle for oxidizing hazards. Gas cylinders we've seen. Corrosion. All right, we stay away from the skull and crossbones with toxicity, right? And so here's some, and then biohazardous. We've all seen that on TV shows and in real life. So you have the safety data sheets. It identifies the harmful materials, also provides guidance on how to deal with it safely. And also can you identify what equipment should be used. So PPE, hands, face, other body parts where necessary. So often you need a combination of equipment. So just wearing a mask isn't satisfactory. You need to wear a mask and you need to wear a glove. You also have to be careful that the protective equipment is used properly, and just a mask doesn't automatically filter out. There will be people who are not wearing the right types of masks in the pandemic world that we are in. So it's actually doing nothing. And we've seen people criticize for having masks that have these big holes in them. So that's really not doing anything. You need the right type of mask to prevent inhaling the COVID virus. Again, pre-employment and pre-placement medical exams should be conducted. So to find out what the employee's health is before they get into the workplace, follow-up exams, record keeping, etc. measuring the types of exposures, personal hygiene, places for people to wash off properly, showers that you would have at work. And again, and I would think that we've all had this where we've had a situation where, we'll get, say, tissue to touch our lips and nose and eyes rather than touching it with our hands. That might be contaminated. So again, washing hands before eating or drinking, we've all done this. Certainly at some times, maybe not all the time. And then, of course, you have a video link for on asbestos. So hopefully you found that helpful.